we have called for the dismissal of Honorable Sylvia Masebo for 3 reasons. Number 1, she was embroiled in that first scandal of $100 million.
What's up? My name is Ken Bimbo, the MC with the sauce. Don't forget to subscribe to J. Cool.
Then we had the $65 million scandal. The Zambia Medicine and Medical Supplies Authority, ZAMSA, we talked about it as members of the opposition when the document leaked that they were trying to procure medicine from an Egyptian procurement agency. It doesn't manufacture any medicine. It's an agency, and we're going to pay it up to $70 million for it now to look for medicine, whether they were going to look for medicine in Egypt or in India, then send it to Zambia. You must have seen the coverage around that matter, $70 million or $65 million. We heard from ZAMSA today that what eventually was signed was around $24 million. But with this government, you can't be sure until we see those signed contracts, because the tender document we saw was $65 million. We didn't see a tender of $24 million. No one has seen that tender of $24 million, but it's scaled down to $24 million. Finally, you saw the visits to Egypt led by Ministry of Health officials and State House officials. You saw the agreement signed by ZAMRA and ZAMSA. And as is corruption is, the Egyptians began to send the trucks, the consignment. The consignment worth of these medicines were stuck in Beira from November 2023 up to around January, February. And government was alerted, your goods are here, they're in Beira, pay your transporter, let them take. And you know how perishable medicine is. You know how sensitive medicine is. You can't just leave it packed in containers in Beira, near the sea, in deep rain season. But that's what we did. The trucks finally began to flow by January. And by April, nearly all the trucks were here. IV fluids. I don't know why we are buying IV fluids from Egypt when they are manufactured here. I don't know why we are buying syringes from Egypt when syringes are manufactured here. But as usual, the minister at Ministry of Health has raised the war with local suppliers and local manufacturers. She doesn't want to do anything with these entities in Zambia. She's made it very public. She accuses them of fighting her. She is very relentless in fighting the local people. And she has not given them an opportunity to supply to government. So she went to India and she went to Egypt. The biggest scandal in all this is that you've had medicines up to over 61 containers marooned and parked just right here in Makeni. The transporter has been asking for his money. The transporter says your goods have arrived and they are in an open yard in Makeni. We understand these are sensitive things like medicine. There is wind, there is dust, there is heat, there is cold, there is rain. Please collect your goods. No, it appears the minister was not aware who was in the forefront of pushing this agenda. It appears State House, who had traveled to Egypt with the minister, was not aware that the goods were here since November from Beira. The colleagues at ZAMRA, I feel bad for Victor Nyasulu because he was only appointed way after this scandal was consummated. What happened? He seems also not to have been aware. Permanent secretaries, all the 3 permanent secretaries at Ministry of Health claim they are not aware. That's the sad part about corruption, is as soon as the goods are paid for, no one bothers if the goods have come because everyone has walked away with the commissions. Everyone is satisfied. And the painful part for many Zambians is that during this period, is that for the last 3 years, we have had persistent drug shortages. no medicines in hospitals, no medical supplies, no laboratory reagents. I'm a X-ray, I'm a CT scan, nothing really works. Nothing really works. The Cancer Diseases Hospital is literally closed. You heard they said they'll be taking patients to Tanzania and to India. Nothing works under this ministry the last 3 years. All we hear are excuses and excuses. You remember the picture of the president when the opposition kept on talking about lack of medicine. Every radio station you open, people were crying about lack of medicines at hospitals. The PS, the minister, everyone was assuring us that the medicines are in hospital. Hospitals were just making noise. They were not. The president even went to work at Ministry of Health for an entire afternoon, if you remember. But we had medicines marooned in Makeni. We have no IV fluids. People can't get the IV fluids, but the IV fluids were stuck and marooned in Makeni. And now they want to blame who? Now they're looking for a folk guy, and it looks like Zamsa and this director general is a folk guy who they will penalize. Now, we have called for the dismissal of Honorable Sylvia Masebo for 3 reasons. Number 1, she was embroiled in that first scandal of $100 million for Infectious Diseases Hospital. It was set for $100 million. The contractor even made public documents where he even alleged that the minister had asked for a bribe, that the minister had asked for a high-value vehicle, that he had actually hosted the minister in South Africa. Who was punished? Even when the people involved in all this, who was punished? A distinguished man called Dr. George Magwende. He was dismissed, humiliated with an arrest. And we don't even know what has become of that case. Honorable Sylvia Masebo escaped that $100 million scandal, despite the overwhelming evidence that came to the attention of the public. Now we have this scandal, $65 million. Even when they say it's $24 million, but $24 million partly. The entire vice president of the US was here, and she gave us $16 million, and it graced all the newspapers as big headlines. So whether it's $24 million or $65 million, that's a lot of money. That's a lot of money. Who will pay for this? Victor Nyasulu? I hold the minister responsible for this sector. She can't be passing on the buck. 3 permanent secretaries, distinguished like Professor Lakson Kasonga, was fired, removed. Dr. George Magwende, dismissed, humiliated, arrested, and paraded as a thief. 3 permanent secretaries in one ministry. Yet we know where the problem is. Here, the president has made changes, and everyone is laughing at the changes the president has made. Because ubulema buli ku Ministry of Health, mwaya ikata ku energy. Okay, ku energy kwa ubulema. But what are you doing at the Ministry of Energy? That is the talk of the town today. Are the 61 trucks marooned in Makeni, where the ministry has even spent more money, 9 million kwacha, in what we call demerit charges. Demerit charges are the charges you accrue per day when you park your car. Whatever parking pama car park ngamwadishwa ngawaisha moto kwa ushukashika nshinga wa parking sha 20 kwacha, 25 kwacha. It's the same thing with trucks. You park them in a yard per day, you accumulate demerit charges. The simple things required that they pay the transporter, that they clear the goods with ZRA. And in this case, these goods should be duty-free. All you need is just signing papers. The authorities to give the papers that these are goods destined for, Zambia Medicine and Medical Supplies Authority, ZAMSA. The documents were never done. 7 months. Now we should get the story and be excited that no, now the ministry has moved in, it has sent ZNS trucks, and we are offloading. Who will even take that medicine? Uyo muti, nani akanwa uyo muti? I dare ask, is that medicine safe? Stranded and stuck in Beira for 3 months, then stuck in Makeni for the last 7 months. Yadikala palukungu, pakasuba. Is that medicine safe? Because medicines have prescribed manner in which they are stored. This is one of the biggest scandals we've had.
Don't forget to subscribe to my YouTube channel, J Cool, and turn on the notification bell, cause I'm gonna see you in the next video.